I'm Dr. Catherin Harris. If you've clicked on this video, chances are you or someone you love is worried about erection quality, consistency, or confidence. Let me start with this. You are not broken and you are not alone. Erectile dysfunction is common, treatable, and, most importantly, understandable once you know what's happening under the hood. When you understand the system, you stop guessing and start solving. Today, I'm going to walk you through exactly what an erection is, why it sometimes fails, what your symptoms are trying to tell you about your overall health, and the practical steps that actually move the needle. No scare tactics, no gimmicks, just clear science, calm strategy, and the steady reassurance you deserve. First, let's simplify the biology. An erection is a coordinated team effort between your brain, your hormones, your nerves, your blood vessels, and your pelvic muscles. Desire or stimulation lights the spark in your brain. Your nerves carry the signal down the spinal cord and into the pelvis. Tiny chemical messengers tell the arteries in the penis to relax. Blood flows in, and the veins compress so the blood stays there. Think of it like filling a high-pressure, expandable chamber while simultaneously closing the drain. Blood goes in, the smooth muscle relaxes, the tunica around the chambers resists expansion in just the right way, and the result is firmness. Lose signal from the brain and nerves, lose the chemical message, block the arteries, fail to compress the veins, or tense the wrong muscles, and firmness slips. Now zoom into the chemistry. The star messenger is nitric oxide. When you're aroused, nerve endings release nitric oxide into the smooth muscle lining the penile arteries and the erectile chambers. That nitric oxide tells the cells to make cGMP, a molecule that relaxes smooth muscle. Relaxed muscle means the arteries open, pressure rises, and the veins get compressed. Another enzyme, PDE5, breaks down cGMP once the job is done. Many first-line medications work by inhibiting PDE5 so the signal lasts longer. But notice the implication. If the nitric oxide spark is weak because the endothelium, the inner lining of your blood vessels, is unhealthy, pills may help, but they aren't fixing the root problem. They amplify a signal. They don't create it from nothing. Erections are vascular events, so anything that injures blood vessels injures erections. High blood pressure stiffens the arteries. High blood sugar, prediabetes or diabetes, damages the endothelium and the nerves. Elevated LDL and triglycerides contribute to plaque that narrows the inflow. Smoking reduces nitric oxide and accelerates vascular aging. Excess belly fat releases inflammatory signals that disrupt hormones and vessel function. Poor sleep raises stress hormones that constrict blood vessels and blunt the nitric oxide response. If your erections have slowly faded over months or years, that's a vascular story until proven otherwise. And I want you to hear this clearly, that early fading is often a red flag for heart and metabolic health. Many men first discover something is wrong with their cardiovascular system because erection quality changed. Listening to that message is brave, wise, and potentially life-saving. But not all erectile problems are vascular. Nerves matter too. The pelvic nerves are like fiber optic cables carrying arousal signals. Back injuries, diabetes, pelvic surgeries, and even cycling with an ill-fitting saddle can irritate or injure those pathways. The pelvic floor muscles also matter. If they're too weak, you can't compress the veins to trap blood. If they're too tight, they can choke blood flow and increase anxiety sensations in the pelvis. That's why a carefully taught pelvic floor program, real Kegels for men paired with relaxation and proper breathing, can be transformative when done correctly. Strength alone isn't the answer, coordination is. Hormones set the background music of desire and performance. Testosterone doesn't magically create erections, but it tunes your brain's interest, energy, and the sensitivity of the erectile tissue to nitric oxide. Low testosterone can contribute to low libido and unreliable stiffness, but it's rarely the only factor. Thyroid issues, high prolactin, elevated cortisol from chronic stress, and even very low body fat in overtrained men can wobble the system. If your morning energy is low, your mood is flat, your waist is expanding, and you've lost spontaneous or morning erections, a hormonal checkup is smart. Because hormones interact with sleep and nutrition, restoring them begins with foundations before considering advanced therapies. Psychology is not all in your head, it's in your body, too. Anxiety triggers your sympathetic nervous system, the fight or flight mode, which is excellent for sprinting and terrible for staying relaxed and open to blood flow. You can't force an erection with fear. That's why even one bad night can create a loop. You worry it will happen again, your heart rate climbs, your breathing shallows, and blood flow diverts away from the pelvis. The solution is not to try harder. The solution is to take pressure off performance, build reliable arousal habits, breathe deeply to signal safety to your nervous system, and rebuild confidence step by step. The fact that you can achieve firmness alone but struggle with a partner often points to a performance anxiety loop, not a broken body. Medications can nudge the system in both directions. Some blood pressure drugs, certain antidepressants, finasteride, and others can dull arousal or disrupt the erection cascade. Never stop a prescribed medication on your own, but do talk to your clinician. Alternatives often exist. Alcohol can help you relax in the short term while sabotaging performance in the moment and over time. Nicotine constricts blood vessels instantly. Vaping is not a free pass. Recreational drugs can confuse hormone signals and desensitize dopamine pathways that help you feel rewarded by real intimacy. So, how do you translate all this into action? Start by listening to the pattern of your symptoms, because patterns point to causes. If morning erections are intact, solo function is good, but partner sex is unreliable, think performance anxiety, relationship stress, or timing issues, especially if it came on quickly. If morning erections have vanished and everything has slowly declined, look first to vascular and metabolic health. If erections are fine but maintaining them is hard near climax, think pelvic floor coordination and anxiety. If desire is low across the board, investigate hormones, sleep, stress, and depression. If you have numbness, tingling, or pelvic pain, bring up nerve health and pelvic floor overactivity with your clinician. Here's a simple, calm, high-leverage plan. You can start now while you schedule a checkup. Take your blood pressure, fasting glucose, and lipids seriously. Aim for a waist circumference under half your height. Belly fat is inflammatory. Train your endothelium like you train your muscles. Brisk walking or cycling most days, plus 2 sessions of resistance training weekly. Exercise boosts nitric oxide, improves insulin sensitivity, and supports healthy testosterone. Sleep 7 to 8 hours with a consistent schedule. Sleep deprivation crushes testosterone and increases cortisol. If you snore loudly, wake unrefreshed, or have morning headaches, screen for sleep apnea. It's a silent erection thief and fully treatable. Eat for arteries, plenty of vegetables, legumes, nuts, olive oil, berries, and fish. Reduce ultra-processed foods and added sugars. Hydrate, but taper fluids in the evening if nighttime urination interrupts sleep. Limit alcohol to avoid relaxed but unreliable. If you smoke or vape, your erections are begging you to stop. Ask for help, not willpower. Add pelvic floor training the right way. Sit tall, breathe in through the nose and down into the belly. Then, as you exhale, gently draw up the muscles you'd use to stop urine and gas. Not your abs, not your glutes, not your face. Hold for 3 to 5 seconds, then relax completely for the same length of time. 10 quality repetitions twice a day is plenty to start. Pair this with relaxation work, long, slow exhalations, box breathing, or a short body scan that softens tension in the hips, thighs, and lower abdomen. Think of it as tuning the instrument, not just flexing it. Within a few weeks, many men feel better control and endurance, especially when they practice without rushing. Now let's talk about medications and devices in a way that makes sense. PDE5 inhibitors, the class that includes well-known pills, do not create desire. They help you convert desire into a sustained erection, by strengthening the nitric oxide signal. They work best when arteries are reasonably healthy, you're adequately aroused, and you've eaten lightly. A heavy fatty meal will slow absorption and blunt the effect. There are important safety considerations. If you take nitrates for chest pain or certain forms of pulmonary hypertension, these pills are contraindicated due to dangerous drops in blood pressure. Always be honest with your clinician about every medication and supplement you use. Vacuum erection devices can increase blood inflow and help maintain tissue health, especially after prostate surgery. Injections and intraurethral medications directly relax smooth muscle and can be highly effective when pills aren't. For some, penile implants are a definitive solution with high satisfaction, but that's a decision made thoughtfully with a urologist after trying conservative options. Hormone therapy is not a magic bullet. Treat proven testosterone deficiency when lifestyle corrections are in place, symptoms are meaningful, and you've had morning measurements on at least 2 days. Ideally, alongside evaluations of LH, FSH, thyroid function, and prolactin when appropriate. If you're considering therapy, weigh fertility plans carefully. Some treatments can reduce sperm production. For men with normal testosterone, boosters rarely fix erectile issues and can even muddy the waters. Anchor yourself in sleep, nutrition, training, and stress regulation first. These are powerful endocrine tools. What about the role of the mind? Your brain is your largest sexual organ. If your arousal has been trained to require constant novelty, extreme stimulation, or a specific script, real-life intimacy can feel too quiet at first. This is not moral failure, it's neural conditioning. You can gently retrain it. Take pressure off the finish line and invest in slow build-up with a partner. Breathing together, non-goal-oriented touch, extended kissing, eye contact, gradual escalation. Agree on a no-performance week where the goal is exploration, not penetration. Paradoxically, erections return more reliably when they're not on trial. If anxiety spikes, return to the breath. Inhale for 4, exhale for 6 to 8, drop your shoulders, soften your jaw, unclench your belly. Those signals tell your autonomic nervous system that you are safe, and safety is fertile ground for arousal. Let's address timing, because timing matters. Many men try to be intimate late at night, after a heavy dinner, 2 drinks, and a long day. That's asking a tired, stressed body to deliver peak performance on command. Try flipping the script. Plan intimacy when you're rested, morning or early evening. Eat lighter beforehand. Give yourself a buffer from screens. Blue light and scrolling drain attention and spike stress. Small shifts like these are often the difference between struggle and ease. If erections became unreliable after surgery, especially prostate surgery, know that nerve recovery can be slow. Early rehabilitation with a urologist's guidance matters. Vacuum devices, low-dose PDE5 support, and regular, gentle arousal to bring blood into the tissue can preserve structure while nerves awaken. Patience is not passive here. It's paired with an active plan. If curvature or pain developed, signs of Peyronie's disease, see a specialist early. There are effective therapies, and early attention helps. Here's a directed checklist to take into your next appointment, so you leave empowered rather than overwhelmed. First, bring a blood pressure log, recent fasting glucose or A1C, and a lipid panel if you have them. Ask for a morning total testosterone with sex hormone-binding globulin if available, and consider TSH and prolactin if your clinician suspects hormonal contributions. Share a list of medications and supplements. Describe your pattern, onset fast or slow, morning erections present or absent, solo versus partner differences, ability to get versus ability to maintain. Be honest about sleep, alcohol, nicotine, and stress. If you snore or wake unrefreshed, mention it. If you have leg pain when walking or chest discomfort with exertion, that's urgent cardiovascular information. Say it out loud. Your goal is a plan that addresses both symptom relief and root cause. Now, I want to give you a practical 4-week reboot. Not perfection, just consistent, realistic steps that build momentum. Week 1, Clean up the foundations with compassion. No crash diets, no heroic workouts. Walk at least 30 minutes 5 days this week, ideally outdoors. Add 2 brief strength sessions focusing on major muscle groups. Push, pull, squat, hinge. 20 to 30 minutes is enough. Lights out on a schedule. Aim for a regular bedtime and wake time, even on weekends. Keep your bedroom cool, dark, and quiet. Lower alcohol to no more than 1 drink on the days you drink, and leave at least 3 alcohol-free days. If you smoke or vape, book an appointment now for cessation support. You don't have to do this alone. Start a simple breath practice. 3 times a day, pause for 2 minutes, inhale for 4, exhale for 6, relax your jaw and belly. Week 2. Tune nitric oxide and the pelvic floor. Add a daily salad with a rainbow of vegetables and a serving of beets or leafy greens most days. They're rich in nitrates that your body can convert to nitric oxide. Replace refined grains with whole grains at one meal. Practice pelvic floor contractions properly. 10 reps, twice a day, with equal focus on full relaxation between contractions. If you can, book a session with a pelvic floor physical therapist who works with men. That one appointment can correct years of misunderstanding. Begin reducing late-night heavy meals. Keep your last full meal at least 3 hours before sleep. Week 3. Restore your arousal rhythm. With your partner, agree to a pressure-free intimacy window. The goal is connection, not a test. Keep hands slow, breath deep, and attention present. If worries intrude, say them kindly and return to sensation. Solo practice? Slow it down. Decrease reliance on intense visual stimulation. Reacquaint your brain with real-world pace, touch, and imagination. If anxiety is high, try a brief guided body scan beforehand. Consider a lighter trial of a PDE5 inhibitor if your clinician approves, not as a crutch, but as a confidence bridge while you rebuild health. Stay mindful of contraindications and timing with meals. Week 4, refine and personalize. Track what helped most. Earlier timing, less alcohol, pelvic floor control, better sleep, double down on your winners. If erections remain inconsistent, don't white-knuckle it. Follow up for deeper evaluation. You may need a different medication, a device, or focused therapy. There is no moral scorecard here. The best plan is the one that restores your health, your confidence, and your connection. A brief word on supplements because I know you'll ask. Some nutrients support vascular and metabolic health. Magnesium for relaxation, omega-3s for lipids, vitamin D if you're deficient, a diet naturally rich in polyphenols from berries, cocoa, and olive oil. L-citrulline and L-arginine are often discussed as nitric oxide precursors, with mixed evidence. They're generally safe for many people but not universally effective, and they are not substitutes for addressing blood pressure, glucose, sleep, and training. Be cautious with male enhancement blends. Quality varies wildly, labels are often inaccurate, and interactions can be dangerous. If you're going to try something, clear it with your clinician, especially if you take medications. Let's come back to mindset for a moment. You don't have to earn intimacy by perfect health first. You're allowed to enjoy closeness while you heal. You're allowed to ask for reassurance without shame. You're allowed to learn new ways to relax your body and direct your attention. You're allowed to say, let's try earlier in the evening, or let's go slow tonight, or let's focus on connection instead of goals. Small relational shifts are powerful because they lower the sympathetic surge that interrupts the erection cascade. Your body is exquisitely responsive to safety, kindness, and patience. Give it those consistently, and it will surprise you. If you're watching this and thinking, this sounds like a lot, let me simplify even further. 3 actions starting today. First, walk after your next 2 meals and go to bed on time. Second, do your 10 quality pelvic floor reps and 3 rounds of slow breathing. Third, schedule the labs and the checkup. That's it. You don't need to solve everything at once. Every step improves not only erections, but your heart, your brain, your mood, and your future. Before we close, a few red flags that deserve urgent care. Chest pain or pressure with exertion, fainting, severe shortness of breath, sudden weakness or numbness, significant leg pain when walking that eases at rest, or a painful, persistent erection lasting more than 4 hours. If any of these are present, you need immediate evaluation. If you've had a rapid change in erections accompanied by weight loss, night sweats, fevers, or new neurological symptoms, don't wait. I want you to remember why this matters. Erections are not just about sex, they're about circulation, vitality, confidence, and the quiet knowledge that your body responds when you ask it to. When erections falter, your body is whispering, "Please listen." Listening is not failure, it's leadership. When you take care of the vessels that feed an erection, you're taking care of the vessels that feed your heart and brain. When you calm your nervous system, you're training resilience for work, parenting, and every pressure life brings. When you practice presence with a partner, you're building a relationship that is stronger than any one night's performance. So here's your invitation from me, Dr. Catherin Harris. Breathe. Decide that your health is worth your attention. Choose consistency over intensity. Train your arteries, respect your sleep, strengthen and relax your pelvic floor, nourish your hormones with food and sunlight and movement. Ask for help without embarrassment. The strongest people are the ones who know when to team up. Use medications thoughtfully when appropriate, not as a mask, but as a bridge. Give yourself time. Most importantly, keep the conversation open with your clinician and with your partner. Intimacy thrives in honesty and patience. If this video helped you understand what's really happening in your body, keep going. Rewatch the parts that spoke to you. Write down 3 actions for this week. Tell someone you trust what you're working on. Your body is designed to heal more than you think, and progress here is often quieter and steadier than Instagram would have you believe. You deserve reliable, confident, connected intimacy. Not someday, but starting now, one calm step at a time. I'm Dr. Catherin Harris, and I'm proud of you for being here, learning, and taking ownership of your health. Keep your shoulders down, your breath deep, your walk strong, and your heart kind, and let your next chapter begin.